Hello, everyone. My name is Joseph Muller, and my presentation is on mental illness. Today, I will be focusing in on one of the most common mental conditions, anxiety disorder. Mental illnesses currently affect approximately 23% of adults in the United States. These illnesses are broken down into two main categories: any mental illness and serious mental illness. Depending on the category of the mental illness is placed in, the severity of the condition may range anywhere from mild, moderate, to severe. Mental illness conditions tend to affect females more so than males. The prevalence noted in females was approximately 27% compared to 18% in males, respectively. For severe mental illness, females again have a higher prevalence at 7% compared to 4% for males. The National Institute of Mental Health stated that approximately 31% of adults have, are, or will experience any anxiety disorder at some point in their life. Some of the signs and symptoms of anxiety disorder include being restless, on edge, feelings of panic or fear, difficulty concentrating, irritability, having frequent headaches or muscle aches, sometimes stomach pains, difficulty controlling your fear of worry, and difficulty falling or staying asleep. People with generalized anxiety disorder may have had some sort of significant change in their life that could be triggering these signs and symptoms. Some other suggested causes for generalized anxiety disorder include traumatic experiences, such as, any sort of traumatic event, either as a child or any more recent traumatic events. It also noted that some chronic medical illnesses may also increase the risk of anxiety disorders. There are many different types of anxiety disorders, some of them being generalized anxiety disorder, social anxiety, phobias, panic disorder, separation anxiety. These are just a couple of them. There are also many more listed in the DSM-5, which is the criteria that are used for psychologists to diagnose such disorders. Some of the current barriers to mental health care include lack of knowledge, appropriateness, effectiveness, and cultural competence, trust, and confidentiality. Lack of knowledge of how and where to seek mental health services is one of the largest barriers. In a systematic review of 14 articles, it identified lack of knowledge as the main barrier for seeking help. Many people believe that it is a complicated process to get the help that they need, and sometimes they figure it's just easier to avoid seeking mental health services altogether. But this would ultimately lead to a population with increasing untreated mental conditions. Another barrier for seeking mental health services would be the perception of appropriateness, effectiveness, and cultural competence. Some of the testimonies that were in the systematic review noted that many of the mental health service workers are not from the same culture, and they don't have a background of the culture and what that culture may accept and believe is appropriate and effective for treating disorders, if at all. Because many cultures do not approve of seeking help for mental illnesses, which again would lead to higher prevalence of untreated mental conditions. And this sort of also ties into trust and confidentiality, where the perception of seeking help with someone they don't know may lead to them being hesitant when discussing a mental illness that they may have. According to the American Psychological Association, the demand for psychologists that treat anxiety disorder has over doubled in the past year, and many of them are unable to meet the demand due to this recent high influx of patients. According to healthcare.gov, all insurance plans must offer some sort of behavioral health treatment, psychotherapy, and counseling, which anxiety disorders fall under. In addition to this, there are no limits that insurance companies can place on spending for these forms of treatment. However, there may be deductibles or copays and limits on the number of visits themselves. With the over doubling of mental health service seeking behavior for anxiety and depression since the beginning of the COVID pandemic, something had to be done. To combat some of the shortages in mental health services and training on mental health professionals to become culturally competent, the Biden administration is spending over $700 million for programs such as the National Health Service Corps, Behavioral Health Workforce Education and Training Program, and the Minority Fellowship Program. The Biden administration is also piloting some training efforts for doctors, nurses, and other clinicians so that they're able to assist in the treatment of mental health disorders like primary anxiety disorder and depression. In addition to this, the Biden administration is also providing an additional $5 million for research into new and innovative treatment methods for mental conditions. For my case study, the case study I chose, it was a 28-year-old white female presenting the clinical symptoms of joint pain and intermittent lower back pain. The patient couldn't recall any injury. She reported trouble falling asleep at night, unable to get a good night's rest. It was noted she also or often felt restless and on edge, which she said that was the reason she was not able to sleep. She stated that she constantly worried about her performance in school, her family, and her mother's health. And her mother had recently been diagnosed with stage 4 small cell carcinoma. The patient also stated that she wakes up frequently throughout the night with headaches that may last a couple of hours at a time. She felt tense throughout the day, causing her to feel stiff and had difficulty paying attention in class. And she was unable to finish a lot of her homework and projects, assignments, etc. This led to an overall high evaluation on the generalized anxiety disorder scale. She scored a 7 out of 10. The score from the outcome measures revealed that the patient had signs and symptoms that are consistent with the moderately severe form of generalized anxiety. The therapist explained to the 28-year-old female that physical therapy wouldn't do anything to cure her generalized anxiety disorder because she was currently seeking physical therapy for her back pain. The therapist suggested education because there's no specific physical therapy intervention to treat generalized anxiety disorder. So the therapist provided some educational information on anxiety management that the patient can use outside of therapy, such as stress management techniques like meditation, deep breathing, progressive muscle relaxation techniques, exercise, and modifying her diet, because those have actually been seen to lower the symptoms of generalized anxiety disorder. So after being diagnosed with generalized anxiety disorder from her primary care physician, the patient was referred back to physical therapy for her back pain, and secondary for her generalized anxiety disorder. So her primary care physician prescribed her a medication which increased her serotonin levels, which greatly improved her motivation for therapy. And within 2 to 3 weeks, her generalized anxiety disorder scores decreased and her overall quality of life increased. Physical therapy, when combined with other interventions, was also noted to be a holistic approach and can significantly improve the overall quality of life in patients suffering from generalized anxiety disorder. If you have any questions, please feel free to post in the discussion board. Thank you.